Dr. Tom Roselle live right now. 105.9 FM and AM 630 WMAL.
Welcome to Dr. Tom Roselle Live. This is Dr. Tom Roselle. We're live in studio on this absolutely stunning Washington day. You know, we've hit the triple lottery here. I think every week that we've been on the air, the last three, it's been gorgeous outside. Well, you have an opportunity. Here's the deal. We're here to answer your phone calls on 105.9 FM and AM 630 WMAL on any aspect of integrative alternative care from a chiropractic, acupuncture, and nutritional point of view, herbs and homeopathics and so forth. 888-630-9625. That's 888-630-WMAL. Love to talk to you. Anything that you have on your mind, well, let's see if we can put a cure to it, if you will. You know, you've had a problem, you've tried, you've applied, you've come up with the same old, not a whole lot of anything. Well, this is an opportunity to fix that without drugs, without surgery, and it may surprise you how simple it actually might be. We have a topic for you today, one that unfortunately so many of us suffer from, one that takes us away from work, stops our life, our activities that we like to do. It can cause everything from pain, throbbing pain, knife-like pain, axe-like pain, electrical pain. What am I talking about? Well, we're talking about headaches. Headaches and migraines. And that will be the topic of our in-house continuing education program this Wednesday evening, December the 14th at 7:30 p.m. Your host and presenter this Wednesday will be Dr. Leonard Poe, who is my co-presenter today. Good afternoon.
Good afternoon.
Glad you're here again.
I'm glad to be here.
Hey, listen, you know, we get on a roll here and talk about all kinds of different things to help people, but this is one that really is a block for so many folks because they suffer to the place where they become totally disabled. I've had patients that had such severe migraines and headaches that they are left in a fetal position, that they just can't function, they can't move.
It's unfortunate.
So let's talk about it a little bit. Let's talk about headaches generally. Are they normal? You know, do you listen to television and they say, take 2 aspirin for your normal headache?
Yeah, well, there's a difference between common and normal. I think that's kind of what we get back to on this topic. But let's say what they're not. It's not an aspirin deficiency in the body, is it? Why don't we cut right to the chase on that?
Yes.
Drugs are not the solution for the headaches. Are actually a blessing. And
there's a lot of people that might argue with you. But
there usually is.
Yes.
They're a blessing because they tell you that there's something wrong in the body. There's some aspect of anatomy and physiology that's just not right. And that's the body's way of telling you, hey, get it fixed. And let's not just cover up the pain with drugs on for some patients, like you said, on a continual basis for years and years and years. But let's actually figure out what the mechanism is and go about fixing it. This is one of those classical chiropractic types of patients that just the success rate is tremendous. It's one of the easiest things to fix.
You know, the literature is heavily referenced in that manual manipulative therapies do more to resolve headaches than any other type of treatment. So it bugs me. Matter of fact, you know the story. I mean, Sue, my wife, had suffered from migraines from the time she was 6 years old, and nobody could do anything for her. And many of our listeners have heard the story, but the truth of it is that it would really knock her out 2 days a week. Either the drug she was taking or the migraine would devastate her. Subsequently, she was, worthless for those 2 days. She couldn't do anything. Got to the point where medically they wanted to fuse her neck. They wanted to fuse the vertebrae, the bones of her neck, in an attempt to stop the irritation of the nerves. And fortunately, my brain said, I don't think so. And I had started chiropractic college at that point in Chicago. And my intention was to go to medical school because I had been accepted. And we were going to spend 2 semesters to find out what all the hullabaloo was about. But what we did is we checked Sue into a private clinic in Elgin, Illinois, Kellenberger Chiropractic Clinic. And what they did was straight up structural manual manipulation, and after all these years, she's 24 years old, 25 years old at the time, and she had suffered from the time she was 6 years old. Within less than 30 days, her headaches were gone, completely gone, off the medication, done. Now you know why I'm a chiropractor today.
See, that's normal and common.
That is normal and common. That is what we see.
That's usually the response.
It is. It's the thing that we see, and we fortunately can celebrate every day in our practice.
It's, I always say I love headache patients because it's one of the easiest things to get resolved.
80% of the patients that we see that present with a headache or migraine type of headache resolve rapidly.
Very rapidly.
There's the
first
Twix.
few weeks. I mean, it's just with manual therapy.
And they go to the medical route and they're spending thousands upon thousands upon thousands of dollars with all kinds of testing, and then they're locked into medications and drugs that have such debilitating side effects that the side symptoms often are progressively more serious than the headache itself.
And it's going to continue to lead into physiology that's giving you the headache in the first place.
Headaches, a patient comes in and they say, listen, I have a headache. And, the first thing that you ask them is, how did it start? How long have they had it? How often it comes? What have they done to fix it? But to really understand the causes and to separate them from a headache that's due to structural problems, which are the majority of them, by the way. Muscle contraction headaches is what they're called. In our field, we call that type of headache a subluxation-based headache, which means that the vertebrae are out of position. They're causing pressure irritation on the nerve roots that go to the skull, go to the front of the head, and so forth. But there can be other types of headaches, hormone-related migraine headaches. Let's talk about the types of headaches. Let's differentiate them. So patient comes in, how would you differentiate them? History
first. We look at a lot of things, okay? It's just a matter of starting to correlate. When does a headache happen? How often is it right after eating? Headache, we talk a lot about food allergies and headaches because those are, especially for the migraine patients, different kinds of food allergies are a big trigger, things that are neuroexcitatory. Does it happen around certain times for female patients during and around the menstrual cycle? We've got
which part?
The rebound, because that's going to tell us, is it progesterone related, estrogen related? There's lots of different patterns, and it's just a matter of sitting down with the patient and looking at the pattern and correlating some of these things. And, headaches are no different than anything else that we deal with. There's not one reason for most people. Typically, there's not. It's going to be several different things. And that's why, I hear patients sometimes say, well, I tried that and it didn't work. Well, did you try, and I tried that and I tried that. Well, did you try these three things together? Because a lot of times that's the key. Because it can be an energetic pattern, it can be a nutritional pattern, and it can be a structural pattern all rolled into one. And it's a conglomeration of those three when they get together that really causes the problem. When you're looking at the triad of health, which is the basis that we look at most things from, structural, chemical, emotional irritations or stressors, if you will, this is a condition, as you said, has to be really picked at from that point of view. You can have headaches that deal with blood sugar regulation. You can have headaches that have dealt with trauma. And they all feed back one to the other. Muscle contraction headache that is due to stress, or a subluxation-based headache that is due to stress, is still a structural headache, and you can help the patient, but you got to find what the underlying triggering mechanism is to resolve that. And by virtue of the things that we do, it's easy to pick it apart. And good old-fashioned dehydration. Number one cause of headaches. Which most people are. That's right. And in this area, we tell patients, you really have to drink water. And some people don't believe that water's for anything but washing. But nevertheless, your body says, yes, I need to have it. Yeah. Hey, you know what we found last night? We're talking about water, and this has to do a lot with headaches. Because of dehydration, we were over at Whole Foods last night. We were walking around looking for something to eat. And we found this new thing. I hadn't seen it before. Maybe you have. It's black water. No. Black water. Yeah, it was in half-liter bottles and small little pony bottles as well. And this black water was not a pH of 9, and it was spring water that was infused with fulvic acid. Huh. And it was just black. So we said, sure, why not? So we took some home and we tried it, and it doesn't taste bad. It actually tastes it tastes like water with, there's a little something different here, but a pH of 9. Now, I have my curiosity up because it's pH of 9 in a plastic container. Yeah. It's like, the other waters that are 7.5 at the source, and then they put them in plastic and you open them up and they're actually 6.9. So even if it drops it down a point, it's still a pH of 8. Why are you going down this road? I don't know. We're going to get 1,000 phone calls about water now. Yeah, I know. Let's talk about headaches. There's no good answer. Yeah, we're talking about headaches. This Wednesday evening, Dr. Leonard Poe will be your host at the Roselle Center for Healing. Let's talk about mattresses next. Okay, in Fairfax. No, don't listen. Just because it's the holidays.
This Wednesday evening at 7:30. If you'd like to join Dr. Poe and you'd like to find out what you can do about your headaches and make a difference and get rid of them perhaps once and for all, this is an opportunity, seriously, that you shouldn't miss. We're here to give you the information. He's going to be there to give you how to fix it, and they are fixable no matter what type of headaches that you have. We're going to talk a little bit more about headaches and migraines and so forth as the show goes on, but give my office a call at 703-698-7117. That's 703-698-7117. Tell my staff that you'd like to attend Dr. Leonard Poe's presentation on migraines this Wednesday evening, the 14th of December at 7:30 p.m. Remember that all of these are a gift to you, but we do require a reservation because, like 2 weeks ago, we were over full and we had to do it again this week. So hopefully you can help many people because headaches are no fun.
I know there's plenty of people out there with headaches.
Oh, it affects over 70% of the population.
It's needless, absolutely needless.
It totally is. There's, the causes of headaches, as we said, are many, but the whole idea is to be able to distinguish them. And as you said, headaches are not an aspirin deficiency. Let's talk about, the simple distinguishing features between, patient says, I have a headache, and my doc said it's a migraine. Is it really a migraine? What's a migraine, doc?
Well, from that perspective, you've got your classic migraines, you've got your common migraines, and that's the thing that kind of bothers me about the whole headache spectrum is we like to assign names to them because that just seems to make it all better. Well, now I have a name. When we're talking about migraines, then there's this metabolic disorder that goes along with it. I don't care what the name is. Figure out what's the metabolic disorder. Is it blood sugar handling? Is it a problem with food allergies? Is it a problem with just general blood flow to the brain? When you start to solve those mechanisms, it doesn't really matter what we try to pin down and call it, because you just don't have the headaches anymore. And a lot of times what I see with patients when we talk about migraines and we talk about different kinds of patterns is it follows closely with a lot of the acupuncture meridians that run up along the skull. And that gives you a good idea systemically, what organ function might be involved. Is this a gallbladder headache? And we're talking about, what we're eating. Is this, small intestine, large, different things like that. And you can follow that pattern throughout the skull to see where that meridian goes. And a lot of times it mimics how the headache moves from one side of the skull to another.
Here's an interesting question. I want to go to the phones right now. Charles, are you there? Charles went away. He wanted to ask about epidurals, and I wasn't sure where he was going to go with it, but epidurals are often used to control all types of pain. And, Charles, if you call back, we will take your question because I found it very interesting. Epidurals in the medical arena are used to control different types of things from low back pain to sciatica, pain management. Sometimes, in fact, they do use them to treat headaches, but they're often a steroid injection, which has tremendous amount of side effects. The epidural doesn't cure anything. It decreases the inflammatory response. But we'll talk about epidurals as a pain management process to relieve all kinds of things. Mostly they're used for back pain. They're used for inflammation.
Managing.
Yes.
That's the key. It doesn't fix anything.
It fixes nothing.
Manages it.
That's right. While the problem progressively gets worse over time. So, but we will talk about that. We're coming up to a break. We're talking about headaches, migraines, those things that go bump in the night that make you reach for that aspirin, and it's not an aspirin deficiency. Don't go away. You're listening to Dr. Tom Roselle Live.
Dr. Tom Roselle Live continues now. 105.9 FM and AM 630 WMAL.
Welcome back. This is Dr. Tom Roselle. You're listening to Dr. Tom Roselle Live. We are indeed live in studio, 105.9 FM and AM 630 WMAL. That's how you find us. But how you talk to us today is 888-630-9625, 888-630-WMAL. This Wednesday, the 14th of December. If you got a headache, if you had migraines, if you had anything that's taking your head apart, this is your opportunity. Dr. Leonard Poe will be your presenter, and we're going to be talking about what you really can do to solve these things once and for all. Call my office, 703-698-7117, 703-698-7117. My guest in the studio, Dr. Leonard Poe. We're talking about headaches, but let's go back to the phones. Charles, thank you for calling back. How can we help you, sir?
Yes, I have a question pertaining to something else. I have a family member who has numbness in one of their legs due to spinal stenosis, and he went to a physiatrist who recommended an epidural, and I wanted to find out what you think of that.
Well, the epidural, we started to answer your question, by the way, when we lost your call before, but it's a steroid injection generally. They often repeat 3 of them, but only 3, and they do it every 2 weeks, and it's designed to decrease the inflammatory response to the compression or irritation. Now, what stenosis is a narrowing of the hole that the nerve comes out of, and it's that narrowing is due to either disc space degeneration, where the height gets so small that it crushes the nerve. It can be calcification that gets in there, so you have degenerative changes. It actually can be soft tissue, and that has leakage from the disc approximating that nerve. So the bottom line is, the epidural doesn't do anything except for decrease the inflammation. It's not going to resolve the stenosis. However, if you change the metabolism, if you put the patient through very specific decompression therapy, manual manipulation modes, acupuncture, utilizing laser, we've had a tremendous amount of good luck, good fortune with these. Do you get rid of all of them? No, but a huge majority of them can be resolved. Stenosis is not a life sentence. It's something that if the patient is willing to participate and you do it properly, things can be changed. But as far as epidurals, often if you have a plain old inflammatory reaction, sometimes it will begin to break the pain cycle. But when you have a stenotic pattern, a narrowing due to those mechanical obstructions, it's not going to resolve the issue.
Okay. Could it help, though, with the numbness, at least temporarily?
Probably not.
No, probably make it worse, matter of fact. It'll get rid of pain, but you're talking about 2 different parts of the nerve there. The numbness, you've got to take the pressure off the nerve to get the numbness to go away, and that's decompression.
Mm-hmm.
Steroid injections, they're also used as block as a local anesthetic, and again, that numbness is not a pain pattern. It's the loss of sensory feedback to the system. It's not going to fix it. Mm-hmm. So, but you have to decompress the nerve. If you decompress the nerve, there's lots that can be done. And the pain patterns sometimes are amazing. They go away. The diagnosis here is important because stenosis doesn't have to cause pain and doesn't have to cause numbness. It can cause many other things, but the pain and the numbness can come about because of things that are not associated with that. If it's really in the low back, it could be instability in the sacroiliac joint. And if that joint isn't stabilized, if the chemistry of the body isn't stabilized, if your brother, for example, sugar, sodas, coffee, black teas, fast food, fried foods, alcohol, gluten, additives, preservatives, these are all things that cause inflammation. And with inflammatory levels high in the body, the joint space continues to stay inflamed and it continues to degenerate. So you shift the biochemistry and you begin to see changes with mechanical processes. And also there's nutrients that will begin to help that. But not knowing his specific conditions, very difficult to say, do X, Y, and Z or what the outcome potentially might be. But I can tell you that the epidural in the presence of a stenotic joint space is probably not going to work.
Okay, thank you.
You're more than welcome. Charles, thank you for calling. Unfortunately, we see that all the time.
Yeah.
And they don't work. If there's an inflammatory reaction where the disc just got dinged and there's a little swelling in the disc, they do help.
Yeah, it'll cover up the inflammatory pain, but it's not going to fix any of the neurological pain. It's not going to fix any of the numbness, anything like that.
No.
If the joint's deranged, it's got to be put back in place, and you've got to give the support back to the joint and give the proper biochemical support to get it to heal correctly.
Yeah, that's
the difference between a quick fix and something that you've got real resolution with.
The body heals. The body's an amazing, amazing machinery. It will heal. We're coming up. We're going to have to take a break for news and some very important information. We'd love to take your phone calls. 888-630-9625. That's 888-630-WMAL. This Wednesday evening, Dr. Leonard Poe will be your host, your presenter, in our office. We're going to be talking about headaches of all kinds, migraines, hormonal headaches, contraction headaches. Call our office, 703-698-7117. Welcome back, Dr. Tom Roselle. You're listening to Dr. Tom Roselle Live. We're here at 105.9 FM and AM 630 WMAL. And you can talk to us at 888-630-9625. This Wednesday evening, Dr. Leonard Poe will be your presenter for our in-house continuing education program. He's my guest today in studio, but if you want to find out how to get rid of headaches, migraines, without drugs and finally stop suffering from something that can really ruin your life, this is your opportunity. 7:30, Wednesday, the 14th of December, at the Roselle Center for Healing. Give our office a call at 703-698-7117. If you'd like to check us out, go online at rosellecare.com. That's ROSELLECARE.com. And if you'd like to re-listen to this program or many of the other ones that we have online for you, go to roselleradio.com, and they're there for you to download and keep and listen, and tell your friends that you can listen to Dr. Tom Roselle live anytime, no matter where they are, by going online, WMAL.com, listen live, and you can hear the program no matter where you're at. Don't miss a week. Dr. Poe, we're talking about headaches, and this Wednesday evening we have a couple more phone calls, several, and we're going to take them, but let's talk a little bit about the distinguishing features, if you will, between migraine headaches and, there's classic, there's common, what does that mean?
The common headache is the kind that you don't have any what they call auras with. The classic
twinkle twinkle little star.
Yeah, the classic migraines are the ones where you do have those auras, where you'll notice changes in vision, or there's going to be some sensory change in there. The reason why a lot of these happen is we come back, and a lot of this has to do with brain biochemistry and just good old-fashioned neurochemistry. There's a big link between serotonin and migraine headaches. You don't have enough of it, and you think, how many patients do you have that have problems sleeping?
Interesting thing with serotonin, though, it's not a head problem, it's a gut problem.
Yeah.
It's an intestinal tract. Serotonin's produced in the intestinal tract, but affects the head, affects the brain.
Very much so. So, headaches are, they're not unique. It's the whole body, it's the whole physiology, it's how all these different things are interconnected. And whether it's a classic migraine or a common migraine, it's a matter of figuring out, well, what are the missing pieces there? Where's the bad physiology? What are the triggers? How does this come on? And when you start to break that down, then you can really go in and start to fix these things and get a hold of them.
Well, the actual distinguishing feature I'd like to point out to patients about migraine headaches is simply this, that a migraine is a vascular headache opposed to a muscle or a nerve root headache.
I like to make it more complicated.
I know you do. But, I'm the simple guy, I go back to, if I can explain it to your son, who's probably smarter than I am now. Almost 6, right?
Almost 6.
Yeah.
All right, I'll make it real simple.
If I can explain it to him, anybody can understand it.
Okay. What happens with these headaches? Okay, why do you have the pain? All right. We've got to have blood flow to the brain. And when you're not getting the right kind of blood flow to the brain, or you're missing nutrients in the brain, those blood vessels have to dilate. They're trying to get more blood out there. And imagine you've got this network of blood vessels in the brain, and you've got this netting that's surrounding them. And those are nerves. You've got this nerve plexus that surrounds them. And so as those blood vessels start to dilate, they start to hit those nets of nerves, and that causes pain. Sometimes it's sharp, sometimes it's that throbbing type of headache, but it's trying to get blood flow in there. So it's dilating the vascularization, and it's causing you pain. So the key there is, get the brain whatever it needs, and those blood vessels will constrict back down, and the pain will go away. So whether that's just good old-fashioned water, and you're dehydrated, that's that hangover headache that you get sometimes. Whether it's, you need more B12, it's serotonin, whatever it may be, you've got to get the nutrition of the brain that it needs.
Or eating stuff that you shouldn't be eating, causing an inflammatory response, and those veins start throbbing.
Yeah, or the take out of the diet, not the put in part of the diet.
That's right.
Yeah.
June, how can we help you? Thank you for holding. June? Hey, June.
This is June.
Are you there?
This is June.
Yes, ma'am. How can I help you?
Yes, please. I had to go to the hospital the end of August because I was having a lot of cramps, and they diagnosed me as having colitis. Okay. Well, and then 2 days later, they said I had C. diff, right? And they kept asking me if I had been on any antibiotics before I went to the hospital, and I couldn't think of any that I'd been on, all right? And I just wondered, could C. diff come from something like amoxicillin? Because after I got out of the hospital, I realized about 3-4 months before that I had taken amoxicillin because I stepped on a nail. I also went and got a tetanus shot.
Well, C. diff also is something that is affectionately known as Clostridium difficile, And so the problem is that guess where you pick up a whole lot of this stuff? In hospital settings and in clinical settings. Unfortunately, the problem is extensive. It can cause diarrhea. It can cause cramping. It knocks out the normal immune function with the intestinal tract. This is a anaerobic type of bugger. That means it gets into the tissue. It doesn't need oxygen to continue its survivability, so it's tough to get in. It's very, very difficult to eradicate. But when the gut flora is knocked out by any form of antibacterials or any form of antimicrobials, C. diff or other nasty bugs can, begin to lock in. The symptoms often mimic flu-like types of things, and you can ache and you can hurt, and your whole body goes into pain and so forth. A tough bugger. So the short answer is that you could have gotten it as a result of being anywhere near a hospital setting or a clinical setting. The antibiotics can be the straw that broke the camel's back. It can be treated from a medical point of view. The drugs that they use are quite nasty buggers, and they have some other side effects. The introduction of broad-spectrum antibiotics, and they even use some chemotherapeutic agents to go after this thing because it's so tough. But the whole idea is that it's not the bug, it's the terrain. It's the body's environment itself that's causing you to become susceptible to this. So you have to change the body's terrain. You've got to bring up the immunological response. You have to rebuild, repair. No two people are the same, but my guess is going to be that your intestinal tract has all kinds of things that are compromising its balance. My guess is going to be that your fight-flight system, your adrenal glands that are responsible for helping produce mucus IgA antibodies, which is your first line of defense, which allows any type of microorganism from replicating and getting more and more. Those things have to be approached. So, you'd have, but the bottom line is, June, that it can be helped. Where you got it, how you got it, I'd have to take a really in-depth history, but the medications that are out there right now are far worse in some situations than the problem. We see a lot of that in the practice, unfortunately.
Yeah, we do.
People come in and their joints are swollen. They don't feel good. They've got headaches. It's one of the things that can cause a headache type of presentation. It's quite ugly. Let's go back to migraines. We got a couple more calls, which we'll get to, but let's talk about what we're going to be talking about Wednesday evening. You're going to be talking about Wednesday evening, and again, we'd like to encourage anybody that has headache from any source whatsoever that this is an opportunity to really find out what can be done about it, what you can do differently, because obviously, if you still got the headache, what you're doing is not working. Give us a call, 703-698-7117. Tell my staff that you'd like to be there. So let's go. We talked about migraines being different types of migraines, and migraines are a small portion of overall headaches. The greatest type of headache is a muscle contraction headache due to all kinds of things, from allergy irritation to trauma to infections, but we have to distinguish the patterns and the blows and what happened even years ago. So, and patients always wonder, my doctor says I might have a tumor. Tumors, 3 to 5% maybe of all types of headaches.
I think you're exaggerating there too.
Yeah, probably 1%.
Yeah, less than
maybe
that.
2.
It's small. Listen, the thing is, if you've had headaches for years and years and years, it's probably not a tumor. That's something that tumors are the headaches.
You would have been dead by now.
You would have been dead by now. Those are things that you've never had headaches before, and all of a sudden you've got these terrible headaches, and there's other red flags that go up along with it. You have that, you have nausea, you have blurred vision. There's a whole slew of other. All of a sudden, the physiology is just going down the crapper, and there's no real reason why. It's just out of the blue. Those are the things that say, you know what, let's do a brain MR or CT and check things out. But those are extremely, extremely rare.
Here's a question that my patients will bring about because they get mad at me when I make them do it. And I say, get off the caffeine, no coffee. And they go into anywhere from 1 to 2 days up to a week of throbbing. They can't think. Why?
It's called withdrawal. It's the same thing when patients come off of gluten. The same thing happens.
Yeah, they don't like you very much.
It's a withdrawal headache. And, there's no easy way through that. You got to come up with it. Actually,
lots of vitamin C. What's happening is the adrenal glands, the fight-flight system, my opinion, is being taken over and being dependent on the anti-inflammatory or the kick in the butt effect of the caffeine. But what works actually for a lot of patients is tons of water, high dosages of vitamin C, dramatically mitigates the effect of withdrawal of the drug of caffeine. And caffeine's a significant
certainly
drug.
Mitigate it, yeah.
It does. But it's still going to be there. Nothing really gets away from it.
You're not going to get it 100%.
It's, your body's telling you that you shouldn't be doing this stuff. There's a substitution going on.
Yeah, but you got to realize, too, that the light at the end of the tunnel there is no more headaches.
And you feel better.
Yeah, you feel a whole heck of a lot better.
Yeah, your energy comes back online. It takes a little time, but, patients, well, I can't function without my coffee in the morning. Try some water and some lemon juice.
Yeah, and maybe some breakfast.
Yeah, and some breakfast. That's right. It might open you up.
Get some calories in there.
You think. Tom, how can we help you?
Well, I have a problem that a lot of your listeners either have or are going to have pretty soon, and that is I have symptoms of a cold. Now, I can't quite decide whether I have allergy symptoms or a cold symptom. And reading about it, it says that one of the ways to tell the difference is if it's discolored nasal discharge, quote unquote.
No, that doesn't even do it, Tom. Let me clear it up for you, okay?
Okay.
So here's the deal. If you got yellow or green coming out of your nose, you got an infection. If you have white thick coming out of your nose, you probably have an infection. If you have a very kind of a liquidy, mucousy type of thing, then it can either be a viral type of cold or it can be an allergy. If it just happened within the last couple weeks or so, it's probably a cold. If it hits you in the fall, early on, it may be an allergy due to any things that are out there and about.
You're thinking historically, though.
Historically. Of course, I give historical information.
Because the problem that a lot of patients are still having right now, and you could be somewhat victim of this, is that because until, past couple of days, we really haven't had any good frost. So the tree molds and leaf molds have still been out there very heavy.
That's true.
So mold and fungus has been a big problem for lots of patients this fall because
it's hit early, too, this year.
It's been wet, and it hit early, and it's hung around for so long.
Tom, do you normally get this type of thing in the springtime? Or is this the first time for a while?
It's the first time in a while. I've got green discharge, and you're saying that would be an infection?
That's an infection.
What?
That's an infection.
And is an infection mean allergy or
no?
Cold?
It's the end product of one or the other. The allergy can occur first, decreases your immune response, and then you get bacteria that's always around you, and it begins to set up a replication phase. And now you got this stuff in there, and it's making things worse. We're finding a lot of things that help. Are like golden seal and garlic, liquid extracts, something called uva ursi. They seem to be knocking out the bacterial pattern. But you still have to change the environment. You have to make sure that you get rid of the underlying terrain, the problem that initiated to begin with, because you can have 4 people exposed to the same environment, the same condition. One of them will get sick, the other 3 won't. See it all the time.
Yeah. You see a lot of flip-flopping this time of year, too, because the immune system is not just one system. It's broken up into lots of different working parts. And you've got certain systems that are for allergies, certain systems that are for colds and flus, and they flip-flop back and forth a lot of times, especially if it's weak.
Dr. Tom Roselle, you've been listening to Dr. Tom Roselle live. I think I can get out of my mouth. Anyway, 888-630-9625. That's 888-630-WMAL. My guest in studio, your host this Wednesday evening, the 14th of December, Dr. Leonard Poe. He's going to be presenting as our in-house continuing education program continues, a topic on headaches, all types of headaches, migraines and muscle contraction headaches and cluster headaches and you name it. This is your opportunity really to find out what you can do about it once and for all, because as we said before, aspirin is not a result of your headache producing, going away, or any other situation that will mitigate it. What do you think, Doc?
That's absolutely right. It's not a drug deficiency. The big thing that you have to realize is that, like I said, the headaches are kind of a blessing. It tells you there's something wrong with the anatomy and physiology. And just by taking a drug to get rid of the pain does not mean that the physiology is fixed. And if you keep doing that, you keep covering it up for years and years and years, that's when one day you wake up and you're diabetic or you've got heart disease or you have osteoporosis and you've got to have a hysterectomy. You've got to correct the underlying anatomy and physiology. End of life is going to come and you're going to have a whole slew of problems. You're going to have poor quality of health. You're just not going to get up in the morning and do the things you want to do in life anymore.
It amazes me. A patient comes in and we talk to them and I ask them the question, how long have you had it? Well, I've had it maybe a week or two. I said, no, it wasn't the first time ever. And then they go back years. And I said, how can you deal with it? Well, medications always work for me. I've never had any problem until now. The point is that the medication's really not working for you, that the problem's been progressive, and you've been causing many things to occur. From a worsening of the condition of the underlying why is that.
This is like the caller earlier that we had about, the stenosis. If you cover up that pain, but you keep, running around on that low back, and you keep injuring it over and over and over again, and you just don't know it because it's covered up with pain, it gets worse over time.
It's absolutely true.
It's the same thing with headaches. The physiology is going to get worse. It's going to continue to progress until you fix it.
Give us a call, 703-698-7117. That's 703-698-7117. Tell my staff that you'd like to attend Dr. Leonard Poe's presentation, December the 14th, this Wednesday, on headaches. Let's see what we can do to help you. Bill, how can we help you?
I have worsening balance. Can you help?
How old are you, Bill?
I'm not hearing you.
How old are you, sir?
89.
And are you active?
Yes.
Okay. So you having problems just standing and walking, or are you having problems, what type of balance problem? I only got about 15 seconds, so if you can...
It's just when I'm trying to make a change in direction, it's especially difficult to keep from falling down.
The short answer is yes, and unfortunately I can't do the whole thing. You're either having a problem with adrenal function, or the upper part of your neck is out of place, so you're putting pressure on what's called the vestibular portion of the brain, and we'd have to evaluate that, but we see a lot of that. We're coming up to the end of the program. Unfortunately, it goes way too fast. Don't forget, this Wednesday evening, Dr. Leonard Poe, your host, in our office. We'll be here next week, as we are every Sunday at 12 noon, bringing you the most up-to-date information on integrative care from a structural, chemical, emotional point of view. This is Dr. Tom Roselle. See you next week.